And so the coming together and that idea of community is very big in medicine, and it's something you wrote about in your second book called The Community Cure. And, you even bring up this idea of group visits, improving patient care and costs and everything. Can you go into that? Because that's very interesting, as most people are just like one-on-one, you have your appointment, you go in. What does a group visit look like?
Yeah, so it was actually at that conference, Heal Thy Practice, in 2013 when I heard about the group visit for the first time. And my economist brain could never get around the fact that in almost all cases, whatever kind of functional integrative lifestyle medicine was being delivered, the initial thing that happened was an extended visit with the most expensive provider, the doctor. Right. That was how all these appointments started. And that was really the value proposition that those doctors would say, like, okay, you work with me, you're going to pay cash, but I'm going to spend the time with you to really go through your health history and work out what went wrong, when, and why, and then start to understand how we can bring you back to health. That was the way, that's still the way that the majority of that care is delivered. And I couldn't get out of my head the fact that this is a terrible plan, right? If you want to scale this care. Right, because one, the amount of friction in getting a doctor to actually see that maybe their medical education didn't give them the tools enough to get them to reverse chronic illness, that's a huge friction point. That's like humility at scale, unlikely, right? Then the second thing is, now you reorganize your practice to be way less efficient than primary care, right? You're going from a 7-minute visit to like an hour-and-a-half visit. There's just no way that can work at any sort of scale. And that's what we see is that, yes, there have been efforts to sort of productize functional medicine a little bit, but still today, the only way that you can get that kind of care is at best $100 a month, membership, and at most obvious a $5,000 engagement over 6 months, right? Depending on how chronic your issue is and who you sign up with. So that's the state of that care now. And in 2013, I saw a lecture by a doctor who was just like, look, I'm in primary care. I wanted to do this functional lifestyle integrated medicine. I had 16 patients that were all type 2 diabetic on the afternoon. So 2 days before, I just said, hey, instead of me seeing you all one by one, why don't you just all come at the same time? And we'll at least, we'll have a conversation between everyone and we'll be able to spend the whole hour and a half with you rather than 6 minutes each. And that was the beginning of a journey. And are there benefits to treating people collectively, like as a group? And, first of all, it triggered in my economist brain, wow, this actually is unbelievably resource efficient because now, yes, you're having the hour and a half with the doctor, but 16 people are all doing together. And then when you come to understand that actually one person can help another person for free, right? One person's journey is valuable to another. Now you've got a shot at doing something that can really scale and really work because ultimately, it's radically resource efficient. It's not radically resource inefficient. Then throw on top of that, if you do it in the insurance system, it can be profitable to do because you can bill all these people with the same insurance. Their insurances are for the same provider time. Suddenly I'm like, this is reasonable. Like this seems like something that could really happen and work and scale. And so I just kind of got really interested in it. So in my 2015 TEDx talk, I talked about it. And then, I was just sort of like paying attention to it, talking about it on the functional forum here and there, really interested in different people's models who were, doing interesting forms of group care. And then in 2019, it's a big moment. It's like my business partner passed away. So he and I had met in New York. He was one of my customers when I was a rep, and he had got into natural health because he'd had cancer twice. And really the second time that he got it, realizing like, I've got to do something. Like I've got to be participant here. I can't just like wait for the doctors to take care of this because ultimately like I'm dying. And that led him to health coaching. That led to him taking care of his own health. And he passed away in 2019. And it was just a moment to take stock. And I realized at that moment, the plan of trying to get doctors to switch over was necessary, but not sufficient to solve the problem. And it couldn't like the natural end result of my efforts couldn't solve the initial thing that I'd started out on. So I just took that year off and I wrote the Community Cure. And in that came off, one, interviewing so many interesting people that were doing interesting stuff with groups. And the first guy that I interviewed as part of this like 13-part podcast series that I did, as soon as I interviewed him, I was like, this has to be a book. Like, this guy was incredible. His name's Dr. Jeffrey Geller. He had essentially built his own model of group visits. He had done it in the poorest populations of, immigrants in Massachusetts. Some of these groups were still going 20 years later, and they were no longer type 2 diabetes groups because everyone in the group had reversed their type 2 diabetes. They were now salsa dancing clubs and gardening clubs, depending on whether it was summer or winter. And I was like, okay, that's amazing. And I want to follow that thread. And through that process of writing the book, I saw that actually in every clinical niche there is, from pregnancy, where the biggest group medicine in the country at that time was called centering pregnancy, where they essentially just put pregnant women into groups together through their pregnancy time. And you see a 35% reduction in preterm birth with no intervention, just people connecting, right through to some of the more famous examples like Dean Ornish's heart disease program, reversing heart disease, and, reversing type 2 diabetes, reversing Terry Wall's reversing MS in the VA. So I started to see, wow, there's actually, again, in silos, incredible examples of a new operating system of care. You can call it functional integrative lifestyle medicine, paired with this group methodology, was now both clinically potent enough to solve the problem and resource efficient enough to solve the problem. And then that was like, okay, we need to like triple down on this. So I wrote the book. The book came out in January 2020. And then COVID hit and all group medicine was destroyed, right? All the fledgling functional medicine groups at the Cleveland Clinic, done. These all, every Alcoholics Anonymous, done. No Overeaters Anonymous, done. Narcotics Anonymous, done. Addiction groups, done. Everything done, because you couldn't sit in a room together and there was no technology to really scale it. And so, that's been the next step in the journey, was to think, okay, I've spent the last, 15 years now convincing myself and now finding a model that I think can solve the problem at the level that exists. How do we create a way to take all the friction out of adoption? There's a lot of factors that go into that, right? You have to, does it work? Can it scale? Will patients want to do it? And will we find someone to pay for it that's not the patient? And that's what I've been working on the last 3 years.